CDC halting what you deem a successful flu vaccination campaign. Tell us why they're doing it and why it alarms you so much.
It's very alarming because this flu vaccination campaign is critically important to educate the public on why vaccination is so necessary.
Okay, so the flu vaccine is super important, they tell us. The intense flu surge gripping the United States is the worst in years, according to the CDC. They report that it's been one of the worst flu seasons in 15 years, and some scientists are blaming post-COVID vaccine fatigue and misinformation for the sudden surge. They tell us that people are not getting the vaccine. But the article goes on to say it's unknown why influenza cases are suddenly spiking in the United States and that it could be due to this year's flu vaccine not being as effective at protecting against the virus as previous years. Anybody else seeing a flaw in that logic? Saying that the flu is surging because not enough people are getting the vaccine, while at the same time saying that the flu is surging because the vaccine might not be working? People always ask me for the data, so here's the data: 36% average effectiveness rate for the last 10 years. But this CBS News clip from January 24th, 2006 suggests that they've known about the ineffectiveness of the flu vaccine for almost 20 years.
Here's what scientists have found. Over 20 years, the percentage of seniors getting flu shots increased sharply from 15% to 65%. It stands to reason that flu deaths among the elderly should have taken a dramatic dip, making an X graph like this. Instead, flu deaths among the elderly continue to climb. It was hard to believe, so researchers at the National Institutes of Health set out to do a study adjusting for all kinds of factors that could be masking the true benefits of the shots. But no matter how they crunched the numbers, they got the same disappointing result. Flu shots have not reduced deaths among the elderly. It's not what health officials hope to find. NIH wouldn't let us interview the study's lead author, so we went to Boston and found the only co-author not employed by NIH, Dr. Tom Reichert.
We realized that we had incendiary material.
Dr. Reichert says they thought their study would prove vaccinations had helped.
We were trying to do something mainstream, that's for sure.
Were you surprised?
Astonished.
Did you check the data a couple of times to make sure?
Well, even more than that, we've looked at other countries now, and the same is true.
That study, soon to be published, finds the same poor results in Australia, France, Canada, and the UK. And other new research stokes the idea that decades of promoting flu shots in seniors and the billions spent haven't had the desired result.
Yeah, the billions spent have not had the desired result. And here we are, almost 20 years later, doing the exact same damn thing.